spirits, guide and protect I and I. All right, how's everyone doing? You guys good? Oh man, yeah. We're gonna kick off this mini series here on prostate health. All right, this is part one, and part two is coming up next Wednesday. All right, so let's get started. uh, the information presented here is not my opinion at all. I'm not that smart, right? I'm really not that smart. But it's solely founded on in depth medical research, findings, reports, analysis, and studies made available by highly established and recognized medical organizations, urologists, medical doctors, including surgeons, experts, medical scientific study groups, and governmental agencies. All right, I'm really not that smart to bring all this information, but what I can tell you is I'm inclined enough to compile all this and put it in a comprehensive package that's understandable. All right, just simple and easy to understand. All right, that much I know, but I'm not that smart. Okay, before we jump into the information, um, I need to let you know my disclaimer. I am not a doctor or medical professional. I'm an herbalist, health educator, and a researcher. Okay, that's what I do. I'm not a doctor. I do not prescribe medicine, nor do I give medical advice. My work is for educational and informational purposes. Okay, that's what it is. All right, I'm not a doctor, so don't go wrong saying I'm a doctor, because I am not. Okay, blessed evening, greetings. So we're going to discuss tonight the prostate gland, and we're going to learn about what it is. Okay, um, we're going to learn about the three main parts of the prostate gland. We're going to learn about the functions of the prostate gland, hormone metabolism, symptoms, and the diagnosis. Okay, in tonight's program. All right, so this is the first part of three. All right, so let's jump into it. And before we jump into it, tell me how's everyone, man? You guys doing okay? I really hope you guys are safe and your families are well and everyone is in good health. All right, so let's get started. The prostate gland is a male reproductive organ that is about the size of a walnut. Okay, you know how small a walnut is? And it's found at the base of the bladders, right underneath the bladder. All right, in men. All right, that's for us guys, our prostate. That's where it's at. Okay, so fluid produced by the gland helps to protect and feed sperm, okay, which come from the seminal vesicle through the ejaculatory ducts into the urethra. All right, so the urethra is a thin tube through which urine flows from the bladder and out of the penis, and it runs through the prostate gland. So think of the prostate gland as a donut, right? The donut is round, and then your urethra is here, and it goes right through it. Okay, it's up, goes to the up to the bladder, down through the prostate, through the prostate. All right, and goes down through the penis, and that's where your pee comes out of, guys. When you pee, okay, your urethra is where the pee is gonna be flowing from. All right, so your prostate gland undergoes two main growth spurts. All right. The first is fueled by sex hormones made by the testicles during puberty. Right. So this prompts the gland to reach an average weight of 20 grams in adulthood. Okay, about 20 grams when you reach adulthood. Okay, so for some reasons that are unclear, the second growth spurt of the prostate gland begins when men are in their 30s. All right, fellas, in your 30s. It continues to enlarge with age to an average weight of 40 grams. Okay, by the time us guys get to the age of 70. Okay, so historically, the prostate has been divided into three zones. All right, there are 3 zones, and they are layered like an onion. See, when you cut an onion, there are layers, right? The prostate is kind of like that, but it has 3 zones. Okay, the first one is the transition zone, and that is found on the inside of the prostate, and it's the smallest part of the prostate that accounts for about 10% of the gland. All right? Yes, Aggie. Definitely, Aggie. Get informed, guys. Log on. So before I move on, if you have any man in your life who's over 30 or approaching 40, let them know. Share this information with them. Have them log on. They need to know this before they get to about 48, right? 48, 49, 50, that range there. They need this information so they don't get trapped and they don't get stuck with prostate problems, BPH, benign prostatic hyperplasia. Okay, and that's when your prostate swells. All right, so pass it on to your uncle, your nephew, your parent, your grandfather, your brother. All right, pass it on. We need to know this because we're going to get really deep. This is a 3-part series, and we will get into it, and we need to discuss prostate problems. It's affecting black men really, really, really bad. Okay. And when I say discuss it, I'm not talking about coming on Facebook and put all your problems out there. Go talk to your doctor. Talk to your doctor, or if you're working with an herbalist, talk to your herbalist. But don't keep quiet about this, man. Okay, talk to a professional because you may need help. So again, the transition zone is found inside of the gland. That's that first inner layer, like an onion, and it surrounds the urethra between the bladder and the upper third of the urethra. All right. And the second layer on top of the transition zone, second one is the central zone. It's in the middle, right? It's on top of that first layer, right? That first zone. So it surrounds the transition zone and makes up about 1/4 of the prostate's total mass. All right. Share the live, guys, and tag the man in your life. It's important. Okay, so in the central zone, this is where the duct common to the prostate, seminal duct, and the seminal vesicles is found, also known as the ejaculatory duct, right? And the uppermost layer, or the third zone, is the peripheral zone. It represents the main part of the prostate gland. Okay, it's about 70% of the tissue mass. That's part of the peripheral zone. Okay, it consists about 70% or so. Okay, so the transition zone tissue tends to undergo prostatic hyperplasia. okay, which is non-cancerous. Okay, is BPH. It's benign, so it's non-cancerous, but it's swollen as we grow older in age, right? And we can't really stop it. Okay, so if this tissue presses against the bladder and the urethra, it can lead to difficulties urinating, right, guys? That's why sometimes most of us having trouble urinating, right? So this is a common problem among older men. Okay, so malignant or cancerous tumors in the prostate mostly develop in the peripheral zone instead. Okay, that's the peripheral zone is the outside layer. Okay, that's where you would find malignant tumors in your prostate. That's where it would most likely happen. Greetings from Guada, Irie, Guada in the house, Guada in the house. Give me a shout out where you are. Just type for me where you are, so I know where you guys are tuning in from. Okay, so the main function of the prostate gland, the main function is to secrete an alkaline fluid that comprises approximately 70% of the seminal volume. So the secretions produce lubrication and nutrition for the sperm. The alkaline fluid in the ejaculate results in liquefaction of the seminal plug and helps to neutralize the acidic vaginal environment. Okay, there's that balance there. Okay, got to have that acidic alkaline balance. I'm drinking some cinnamon tea. It keeps the mucous membranes of the mouth just nice and soft. Okay, relax and everything. Okay, so together with sperm cells from the testicles, fluid from the seminal vesicle, and the secretions released by another pea-sized gland below the prostate, fellas, and that is called the bulbourethral gland. Bulbourethral gland. The prostate fluid makes up the semen. All of these fluids are mixed together in the urethra. They mix together in the urethra. The urethra is very important, guys. That's what your sperm goes through. That's what your pee goes through from your bladder. Take care of your prostate. Your prostate swells up. It pinches the urethra because the urethra passes right through the prostate. Okay, it passes right through there. The prostate swells up and it pinches the urethra, and you're gonna have trouble peeing. Okay, so the prostatic secretion is important for the proper functioning of the sperm cells and therefore also for fertility in men. Right, guys? So the thin milky liquid contains many enzymes such as the prostate-specific antigen, which is the PSA. Okay, and the PSA level in blood is measured in units called nanograms per millimeter. Okay, so us guys, when we go to the doctor to take your blood sample, and they use the PSA to measure how swollen or how bad your prostate is, right? So it's a prostate specific antigen, and we'll get into PSA in the second segment of this series, okay? So the hormone-like substance spermine mostly ensures sperm cells' ability to move. All right? So, urine ejaculation The prostate and the bladder's sphincter muscle close the urethra up to the bladder to prevent semen from entering the bladder. Because anything goes up in the bladder, you're going to have a problem. So those muscles there, they work. They know exactly what they're doing, when to open, when to close. So during ejaculation, the sphincter muscle closes the urethra. It shuts it where the urethra meets the bladder. It shuts it closed. So semen doesn't go up in the bladder because you're going to have a problem if that happens. So during urination, the central zone muscles close the prostate's duct so that urine cannot enter. Okay, remember the central zone, right? The middle layer of the prostate. It closes the prostate duct so that urine cannot enter. All right. And so in the prostate, the male sex hormone, dihydrotestosterone, is transformed to a biologically active form, which is DHT, or dihydrotestosterone. Okay? Or rather, testosterone, the prostate male sex hormone, testosterone, is transformed into dihydrotestosterone. Okay? And testosterone is an androgen hormone produced by the adrenal cortex, the testes, in those assigned male at birth. All right, so it is often considered the primary sex hormone associated with those assigned male at birth. All right. Hello, greetings, guys. So testosterone stimulates the development of secondary sex characteristics associated with males, with us guys, like body hair and muscle growth, and is essential in the production of sperm. Okay, and testosterone levels decrease naturally with age. Okay, it's a natural process. Okay, so in us guys, lower testosterone levels can lead to hair loss, including on the body and the face, reduced muscle tone, more fragile skin, a reduced sex drive, disturbed mood, memory or concentration problems. Are you guys listening? All right. DHT, dihydrotestosterone, is an androgen, and it helps give males their male characteristics. Us guys. So DHT is thought to cause hair follicles to miniaturize, and this contributes to male pattern hair loss. By the age of 50 years, fellas, over half of us in the United States will probably experience hair loss mediated by DHT. But treatments that block DHT may help prevent hair loss. All right, and we'll get more in depth on the third part of this series. So DHT has many roles. Apart from hair production, it is linked to benign prostatic hyperplasia, or enlarged prostate, BPH, and prostate cancer too. So DHT is a sex steroid, meaning it is produced in the gonads. It is also an androgen hormone. Um, in doing this lengthy research, I was listening to this brother from the United States. He was still in his 40s, and he was being interviewed by a medical doctor regarding the death of his younger brother and his older brother rather, and his dad. So he was saying that his older brother died at 48. He died of prostate cancer at 48, and his dad died 2 months after his brother died of the same problem, prostate cancer. And that kind of woke him up. He decided, heck no, I ain't going down like this. So he went to the doctor. He had his prostate checked, found out his prostate was swollen, but it was benign. It wasn't to the point of being cancerous. But that woke him up. Okay, fellas? I hope you guys listening. Prostate problems are no joke, man. Serious. Talk to your doctor. Make sure you go check yourself out, man. And we're going to get so deep. When I get to the statistics and data part of this presentation, of this series, it's going to be the third part of this. We will see where we are as black men in the realm of things. We're going to see where we are and how much work that we have to do on ourselves when it comes to our health, especially prostate health. We're going to see it's mind-boggling. It's really, really bad, guys, and we have to do better as black men. Take care of ourselves. And ladies, encourage your guys when they get to that age. Encourage them. Go see the doctor, man. Go to a professional and have your prostate checked. Have your PSA. Know your PSA range. And we'll get into PSA ranges and more statistics next week. It is not something to mess around with. Get your prostate checked out. So androgens are responsible for the biological characteristics of male, including a deeper voice and increased muscle mass. So during fetal development, DHT plays a vital role in the development of the penis and prostate gland. All right? Interestingly, testosterone and DHT both bind to the same receptors. However, DHT does so more efficiently. In addition to responding to DHT and testosterone binding, they are different in their responses. So most DHT in the body is bound to proteins such as albumin and sex hormone binding globulin in the blood. This is also true for testosterone. With DHT, less than 1% of the hormone in the blood is circulating freely. This is slightly lower than the amount of free versus bound testosterone. Albumin can bind a large amount of testosterone or other sex hormones, but binds those hormones quite weakly. It has more, it binds a larger amount, but very weakly because there is so much going on. So sex hormone binding globulin, in contrast, binds less hormone but does so more strongly. right? So DHT is more powerful than testosterone. It's 2.5 to 10-fold more potent. It attaches to the same sites as testosterone, but more easily. Once there, it remains bound for a longer period of time. So, in addition to its role in general health and disease, DHT has a number of effects on sexual development and sexual function. At puberty, DHT is critical for penile growth. It works in combination with testosterone to increase the size of the male external genitalia. But fellas, this does not mean that taking testosterone or DHT will increase your penis size, okay? So get this right, okay? So adult men who have completed puberty no longer have androgen receptors in their penile tissue. Once you go past puberty, you no longer have androgen receptors in your penile tissue. Interesting, right? So let's examine some symptoms, right? So fellas, many of us will experience urinary symptoms as we age, right? Natural process again. It's going to happen at some time, which may be caused by inflammation of the prostate gland, which is prostatitis. All right. But in older men, symptoms may be due to a blockage in the tubes due to a benign or non-cancerous enlargement of the prostate gland, again, which is BPH, benign prostatic hyperplasia. The most common symptom is difficulty emptying your bladder. That's the most common symptom. Urinary symptoms may become bothersome enough that they require treatment. But not all urinary symptoms are due to changes to the prostate, right? Because some men have enlarged prostates and yet they experience like few, if any, symptoms, right? So just because your prostate is swollen to a certain point does not mean that you have prostate cancer. Okay, so according to cancer.org on their website, okay, some of the symptoms that we have to look for, guys, and this is serious, all right? I want you guys to pay attention and listen to this. Symptoms, according to cancer.org. Watch out for blood in your urine, or pain or burning with urination. Okay, but these two symptoms right there, they may also be due to a common condition called BPH, right? Again, there we see BPH again, benign prostatic hyperplasia. Prostate cancer that has spread often presents itself as bone pain, okay? So imagine for a second your water hose, right? You're out in your garden, you turn on the faucet and you squeeze that trigger for the water hose and it's just dripping, right? What happened? Because you opened the pipe. What's going on? You ask yourself. But when you check, the hose has a kink. So the kink in the hose is preventing the pressure of the water to just go right through the hose. Right? And so it is with your swollen prostate and the urethra. the urethra is pinched. When it's pinched, okay, and your bladder is full, okay, the muscle walls in the bladder is contracting, and it has to get the pee out because your bladder could only hold a certain amount of pee. It has to get out, but it's trying to get out, and the urethra is pinched, and you are pushing, and those muscles are engaging, and all you get is drip, 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 drip. That's a lot of pain, guys, because your bladder could only hold a certain amount. All right, and the bladder is full, it's filling up, it might be full, and it has to get out because there is pee dripping down into the bladder, right? And it's getting full, and the pee got to get out, but it's not getting out because your urethra is pinched, just like the hose with a kink. Okay, there is pressure. Pressure is building up, and you have to pee. Okay, the muscle walls in the bladder is contracting, and the pee is not going down. So what happens? The pee is just circulating in the bladder. It's just going. It goes down. When it gets here, it's supposed to go through the urethra. It can't go down because the urethra is pinched. It keeps circulating, and the muscle walls keep contracting, and there is more pee coming down in there, right? You got more pee coming down. That doesn't sound like a very good experience. It does not. So, fellas, pay attention, okay? And any of those symptoms, you gotta be careful. Okay, more symptoms. So, urinary symptoms commonly experienced with prostate problems include the need to urinate frequently during the night, urinating rather more often during the day, urinary urgency. The urge to urinate can be so strong and sudden that you may wet yourself. All right? You don't want to get to that point. The urine stream is slow to start. Like you have the urge to pee. You know the bladder is full. You got to pee. Or there is pee in the bladder. You get that sensation. The muscle walls are contracting. And it's just taking forever for it to start, that flow. That flow is taking forever to start, right? That's another symptom. But the urge is there. Urine dribbling for some time after finishing urination. So after you're done, you're done, but there is dribbling going on, like drops and drops of pee coming down. Bad symptom to have. If there is a sensation that the bladder is not fully emptied after urination, it's not a symptom to look out for. Lack of force to the urine flow, which makes directing the stream difficult. Okay, it's another symptom got to look out for. The sensation of needing to go again soon after urinating, another symptom. Although these symptoms often do not need treatment, but please take it from me, take it from the Bushman. I study these things. Okay, I research all this information. Go and see your doctor. Go get checked up, guys. You gotta go. Don't be macho. Go see a doctor. Get your prostate checked. Have it checked out. You have nothing to lose. Check it out. See your doctor if they are causing you difficulty, because they can be successfully treated. Don't be that 48-year-old guy who watched his brother older brother died from prostate cancer, and 2 months later, his dad passed away from prostate cancer. That woke him up. Don't be that guy. Don't wait too late, or don't be his brother or his dad, but you could be him because at least something woke him up. Okay, so symptoms follow up. See your doctor, please, if you experience being unable to urinate. If you can't urinate, look, it's common sense. Your bladder is full, you're gonna have a lot of pain if you can't urinate. I'm telling you, it's gonna hurt a lot. That's one of the worst feelings you may want to experience. Or painful urination, blood in the urine at all, any sign of blood in your urine, any unusual discharge from your penis, continuous or severe urinary incontinence if you can't hold your urine. So bacteria sometimes cause prostatitis, which is inflammation of the prostate. More commonly, the underlying cause is uncertain. Consult with your doctor promptly if you experience fever, lower back pain, pain in the groin, urgent and frequent urination. Okay? Treatment with antibiotics is essential for acute bacterial prostatitis. Admission to hospital is often necessary, and as with chronic or ongoing bacterial prostatitis, specific antibacterial drugs are required for a long time. Take care of your prostate, go to the doctor, telling you guys, get checked out. Okay, so BPH is more common as we guys get older. It can cause troublesome symptoms, although it doesn't always. Okay, and the symptoms are going to be different for everyone, right? We all are not going to have the same symptoms. Okay, that vary. Okay, so the urethra passes through the prostate gland, like I explained earlier. So us guys may have problems urinating if the enlarged gland restricts the flow of the urine, which I explained earlier. If the flow stops completely, a catheter is required to empty the bladder. They're going to choke something up your penis, up the urethra, up your bladder, up the urethra to the bladder to empty it out. And I guarantee you this is going to be freaking painful. You don't want to get there. But it is rare for this form of acute urinary retention to cause kidney damage, right? So an enlarged prostate, again, does not always cause urinary problems. Studies indicate that the size of a man's prostate gland has little influence on the type or severity of his urination problems. BPH is just one possible cause of urinary symptoms. One. Another cause of urinary symptoms can be changes to the muscular wall of the bladder, which may cause spasms of the bladder or weaken the bladder, causing problems passing urine. Again, if you have trouble, urinating, see your doctor. No matter what your age. If your doctor agrees that your symptoms merit further evaluation and treatment, you may need to undergo a few tests. These tests may include general examination, which is medical history and review of any health conditions, including obesity. And we'll get into that obesity part later on in the third part of the series and in its role in BPH and cancer of the prostate. Okay, obesity, diabetes, obstructive sleep apnea, depression, and erectile dysfunction. Okay, and we'll talk about erectile dysfunction later on. Okay, to get a urine check to ensure the prostate is not infected, a flow rate check to estimate the speed with which you pass urine, an ultrasound examination to assess if the bladder is emptying completely, and to examine your kidneys. Also, urodynamics, which is a series of tests on the bladder to see how your urinary system is functioning, may be recommended in some circumstances. Okay, so again, don't forget to check with your doctor if you experience any of the symptoms discussed. BPH and prostate cancer are devastating, destructive, damaging, and in the black man's case, catastrophic and fatal. And there's more to come. Listen up. We as black men, we black men, we should not be dysfunctional and backwards when it comes to prostate health. We should not be dysfunctional and backwards when it comes to prostate health or just health in general, but specifically prostate health, because this thing is kicking our butts. All right? So, next week, Wednesday, February 17th, okay, we'll discuss PSA ranges, risk analysis, and cancer types, different cancer types. Okay, so we will have 3 or 4 weeks of this series. It's going to be a mini series up to 4 weeks, so stay tuned. Remember, guys, do what it takes. You got to do it. I've heard it so many times from so many people, you know, who suffer from BPH and prostate cancer as well. You know, I hear it a lot. In my line of work, I hear it, and in research, you know, all the research that I do, I read about it, I analyze it, I see it, I see the numbers, I see the data. It is not very cool. We're losing, guys. Black men, we're losing this war. Okay, so I hope everyone's in great health. Hope you guys are safe. Please do what it takes to keep your families healthy. All right, I will see you guys next week, Wednesday, same time, 7 o'clock Eastern Standard Time. Peace be unto you and guidance. And we'll talk about another part of prostate problems. All right, guidance.